Welcome! In this video, we will review care for your child with asthma that is being discharged from the hospital. Your child's asthma symptoms became severe enough that your child needed to be hospitalized to provide emergent inpatient care. When your child has asthma symptoms, their airways become swollen, produce extra mucus, and have tightening of the airway muscles. It may take some time for the swelling and mucus in your child's lungs to completely resolve. At the time of discharge, your child may still have some mild symptoms such as cough or mild wheezing. These symptoms may be worse after your child has been actively playing or running. Your child may also be more tired than usual or jittery and irritable from albuterol use. Remember, your child is still in their recovery phase, so try to limit their activity for a few days. It is important to continue to use albuterol or their prescribed bronchodilator medication every 4 hours, even overnight, for at least 2 additional days after discharge. This will be outlined in your child's discharge orders. Albuterol will help keep the airway muscles open and relaxed to allow your child to breathe easier until the swelling and mucus from the illness goes away. If prescribed an oral steroid like prednisone, please be sure to complete all of your prescribed doses. Do not stop until all the medication is done. If your child was prescribed a daily controller or preventative medication, like fluticasone, budesonide, allergy medications, montelukast, or a nose spray, continue to use it as prescribed and as you were taught in the hospital. Be sure to follow up with your child's pediatrician within 1 to 2 days of discharge. This is important to allow your doctor to check your child's breathing and provide instructions for future albuterol use. They may recommend continuing to use albuterol every 4 hours for a few additional days or switch to using it as needed for symptoms. At your follow-up appointment, bring your discharge papers and asthma home plan. Ask your doctor for prescription refills for albuterol and any additional medications that were prescribed while you were in the hospital, such as daily preventative medications. Make your follow-up appointments to monitor your child's asthma control. If needed, ask your doctor to fill out paperwork for the school or daycare that your child attends so that they can also give your child albuterol. Please make copies of your child's asthma home management plan to provide to the school, to the coaches, or a daycare with your child's albuterol and holding chamber. After discharge, be strict about trigger avoidance as your child's airways may be more sensitive to triggers such as environmental allergens or irritants. It is important that you carry your child's albuterol and spacer at all times, whether they are healthy or sick. If you are out of your home and your child begins to have respiratory symptoms or begins to cough, you will have their medication to help their breathing. If you delay in providing albuterol, symptoms may become worse or they may not respond to the albuterol even when it's available. Remember, even if your child has not had asthma symptoms recently, they are still at risk to develop symptoms in the future. Please continue to always carry your child's albuterol inhaler and spacer.